Hi, I'm Simon Whitehouse. I'm the Director for the Health and Care Partnership across Staffordshire and Stoke-on-Trent. Some people know that as the STP. We've been doing some really positive work across the system, and just want to recognise and thank staff for the work they've done in terms of helping navigate through winter. There's been a lot of pressure on frontline staff and managerial staff, but we've done well in terms of managing a better winter than we had in previous years. We've turned some of those clinical dials in terms of cancer, length of time people are taking to wait for operations. So some things are really showing signs of improvement there. However, what we've not been able to do is tackle the financial position in a way that gives us the confidence that we've got control of that. So we've got a real focus in terms of 1920 in looking at some key priority areas and some key programmes and bringing an unremitting focus to the delivery of some elements of change to try and get that level of control. However, what we're not going to do there is just chase the money. If we chase the spreadsheet and we chase the bottom right-hand corner, then we'll miss the point. This has to be about how do we transform services that improves and reduces waste, reduces duplication, improves the patient experience. So what are we doing in terms of outpatients? What are we doing about the number of tests ordered in terms of diagnostics? What are we doing about patients with mental health conditions that get placed out of our area? How are we bringing those patients? Have we got the right services to bring them closer to home? How are we making sure that the patient journey and the patient time is the bit that's the most valuable in our system? I think we've got to make sure we recognise, though, that we've got an eye to the future at the same time as well. Over the next few months, we're going to be having initial conversations with the public and with staff and with our clinicians, talking about what some of their thinking is and what their ideas are around how we start to close the clinical and the financial challenge that we've got over the next 5 years. So I think we've got two things to do. We've got to make sure that organisations are being as efficient as they possibly can, focusing on patient care, that we use the Staffordshire and Stoke-on-Trent pound wisely and efficiently. We've got to make sure that we've got a really clear focus on the transformation programmes that sit where one organisation can't deliver it on their own. We've got to work together in a way that does that for 1920, but we've also got to use the next few months to really shape up some of our medium and longer term thinking about what our proposals are that will take forward the development of the 5-year local plan in response to the NHS long-term plan that was the national plan published just after Christmas.